What is gender-affirming care? Alrighty, y'all. So this is where let me give a whole bunch of disclaimers before I start. So, number one, this is more sociological commentary, maybe a little psychosocial commentary. This is not necessarily the opinions of anybody else in any company that I've ever been affiliated with at all. Again, this is my 0.2 cents out of the $3.2 trillion worth of cents in the universe. I'm just going to give you my perspective. Okay. So gender affirming care. So I live in Texas. I live in Fort Worth, Texas. I'm from East Texas. Went to school in Waco, Texas. Then additional school at Bryan College Station, Texas. Then over to Temple, Texas, before I moved to Kentucky and lived in Lexington, Kentucky. Did a rotation up in Cincinnati, Ohio, and moved back to Texas, where I worked in Round Rock, Texas. Then I moved up to Fort Worth, Texas. And so Texas is near and dear to my heart, which is why I can talk bad about it. And so generally in Texas, for so many of the years that I've known the kind of Texas ethos, it's, small government, it's mind your business, take care of your stuff, pull yourself up by the bootstraps, work hard, get what you want, leave people alone, unless they're doing something that they're not supposed to. Right. So that's generally the Texas ethos. And again, I am a Texan. I grew up in that culture. I still adhere to that culture, even though most times I tend to vote Democratic. And in the world of Democratic voters, they tend to be more systems people. Oh, safety net, big government intervention, blah, 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 blah. That is not me. So in that regard, and so there's a big push right now. So this is 2023 when this whole thing is going on. There's this weird push to restrict people's access to care that they've labeled gender-affirming care. And so that label actually came from the marginalized group of people who are suffering. So lots of folks, there are people who are transgendered who feel that they were born into a body that is not their that they feel they are mismatched with the gender expression that they are, and they wish to change that. And so sometimes in order to do that, there's the sociological stuff. So, wearing different clothes, going by different names, changing your pronouns, the concept of gender in a gendered society. And then other folks take it to the next step, which is medical intervention. So suppressing different types of hormones or taking other types of hormones to have your body do different things. And then there's that kind of third step, which is the surgical intervention to be more aligned with the gender that you feel that you are. Now, whatever you want to say about that or do about that, you can take that conversation. We can have that conversation offline. And I find that those conversations are actually best done either one-to-one or one-to-small group, because when you get a whole bunch of people together, groupthink happens, and groupthink is bad, like super bad. It's like mob mentality, and I ain't got time for that, and it's dangerous. I don't like mob mentality. That's what happened January 6th, right? A whole bunch of people kind of lost their minds in the frenzy, right? Because 6 weeks before that, if you had talked to them, they're disgruntled, they're mad about whatever, and they have their views about whatever. But when you get them all together and you tip that, it tips the scale, bad things happen. So anyway, so this particular conversation about transgendered adults and transgendered kids is very, right now is being very political and being very, very politicized. And it's one of those things where when it runs up into medicine, so it creates a very difficult, well, it's not difficult, it's easy for me. It creates a difficult understanding for non-medical people. So at the end of the day, as a physician, my medical ethics say that I treat the person in front of me. Period. End of sentence. And then if I can't treat them for some reason, whether I, don't agree with their religion or whatever, it is my ethical responsibility to refer them to a person where they can be treated for whatever that thing is. Right. So if you come to me as a Jehovah's Witness and you say, I do not want a blood transfusion, and I say, but I am a Pentecostal and I believe in the blood of Jesus and I'm going to give you blood to save your life because I can't let you die. And the Jehovah's Witness patient says, no, you can't. Well, then I have to respect that person and help find them someone that can work with that person. That's only ethical, right? So that then I'm not violating my stuff, they're not violating their stuff, but they can still get the care that they need, because at the end of the day, it's they are the patient. And so when it comes to this stuff, it's very frustrating. So the people in the transgender community have taken up this term, gender affirming care, which, okay, fine, whatever you want to call it. The hiccup is now there are folks on the other side who are using that as a way to discriminate, to carve out an exception to medical care, so that now they're saying we want to ban gender affirming care in the state. And it kind of infuriates me that not every doctor in the state is going, whoa, 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 you can't do that, because care is care. So gender affirming care, even though they call it that, very well meaning again, it's still care. So as long as a patient is in front of me and we're of the right skill set and situation. So in other words, I'm not a surgeon. So if somebody's like bleeding, I can like put my finger in the hole and say, okay, oh my God, let's get this person a surgeon. But I can't, so in other words, get the right person in front of me, and then I'm ethically and morally and medical legally obligated to help them and not hurt them. So non-malfeasance, don't hurt someone, right? First, do no harm. And so it's very disappointing in this state to hear that there are folks who are going to jump in the exam room and say, whoa, 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 you can't do that. Whereas, now and before, I treat whoever's in my room, even folks that I don't agree with. There's folks who come in and they would sometimes talk politics. And I'm literally like biting my tongue going, no, that's a terrible idea. I disagree with you completely. Why are you supporting that individual? But I still treat them with the utmost respect and due diligence that is required of my job, of my profession. I have to put myself second, and or refer them out again. So I haven't heard anybody come in and disparage me to my face about certain things. But if that happens, because I'm who I am, black and tall or whatever, I would go, well, I'm sorry, I'm not the best fit for you. Well, there's 12 other doctors you can go work with. But at the end of the day, I do the best for the person that's in front of me. And yes, I have patients who are transgender. I work with kids and adults who are transgender. And yeah, I treat them the way that I know that they need to be treated, because, I'm not a Jesus person, but that's kind of what he said, right? So, which is, treat other people like you want to be treated. And the funny part to me is all these folks who are screaming about, oh, we don't want to, have gender affirming care. Fate has a funny way of doing things, because oftentimes there is a family member of that person who is, outside of the quote unquote norm, right? They can be gay or bisexual. Sometimes they're transgender. They have children out of wedlock. They are suffering with drug and alcohol dependence, which is a disease and not just a lack of willpower. They make poor decisions about relationships. They get divorced, like all the things that are like, bad or morally whatever, bereft. And they have these folks who are saying, we want to change the definition of healthcare in Texas, have those folks in their family. And I think the cruelest twist is oftentimes those same people are the ones who are kind of backdoor going, hey, let me go get them help from psychiatrists and therapists and other people while publicly saying the exact opposite. And it's infuriating. And so that's why it's very important that you go vote. So whenever there's an election, make sure you're registered, make sure you go out and vote for the people that align with your interests, especially the interest of, hey, don't be mean to people and don't hurt folks. At the end of the day, we don't have to agree on everything politically, sociologically, or otherwise, but don't hurt people. So all of that is to say, gender affirming care is something that it is care that everybody should get. Everybody should get people affirming care, and which is one of the reasons why I say everybody needs a therapist, because at the end of the day, everybody needs to talk to somebody. Everybody is too close to themselves to be objective, and so if you find yourself going, "Oh, I'm so mad about gender and transgender, whatever," well, if you're not transgender, I can't figure out what's pissing you off so much. And so maybe you should go talk to somebody. And that's what therapists do, is they help you kind of work through some of your anger and things. And then if it's not a therapy issue, there's lots of folks in the diversity, equity, and inclusion space who can also walk you through, the ideas of systemic power shifts and dynamics, all the isms, racism, genderism, sexism, all of those things. I'm not qualified. I have my lived experience. I'm not qualified to speak to all of those other things, all those kind of systems of power. And so, definitely go check out some DEI folks if you want to do that stuff. But when it comes to medicine, when it comes to the exam room, when it comes to my office, leave all those things out. Let people be who they are. Let me help those people live their best life. And I don't think you can go wrong in doing that. So that's my story, and I'm sticking to it. So thank you so much for indulging me with that.